Today we reveal the secrets that could add 10 more healthy years to your life. What if I told you that the way you eat, sleep, walk, and think could be killing you, all saving your life? So millions are living with diabetes and high blood pressure, and many don't even know it, that they have these conditions. So until complications arise, and it is very late. But today could be the day that you can change everything from the knowledge that you get. So welcome to this live presentation from Wellness Health Services. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. I'll give you real life, life-changing lifestyle changes that can reverse your numbers, reduce your medications for hypertension and diabetes, and restore your energy and joy. So I ask you that you stay up to the end of this live presentation, and I'll even have an opportunity to answer your questions in this live presentation. So we are looking at life-saving lifestyle changes for diabetes and hypertension. So let's start with something many people don't realize. Diabetes, hypertension are silent killers. They rarely scream, but behind the scenes, they are damaging your heart, your kidneys, your brain, your eyes, and even your relationships. You are not lazy, but you are not well equipped with the right information that we need to change from today. You need to be more empowered so that you can be able to see what things in your lifestyle, the way you eat, the way you sleep, that you really need to change. And then by changing these behaviors, then you can reverse the risk that are putting you to getting diabetes and hypertension. What you eat, your body is built from food. And look at the 5 lifestyle pillars that can transform your health, starting with what you eat. So food should be your medicine, not what will harm you. Unfortunately, many times we find ourselves eating to harm ourselves. How do we do this? If you eat the sugars, you eat the refined carbohydrates, and you eat very little of greens or none at all, then you are eating to harm yourself. So what do you need? You need whole grains, you need plenty of vegetables, you need low sugar fruits, and healthy fats. These are not just ready, they are therapeutic. So you need to look at your diet, and you look at how your plate looks like. You should aim to have in your plate, if you assume this is your plate, the whole of this, so half of it should be plenty of vegetables. Then adequate amount of proteins, like a quarter of the plate, and then the other quarter or even less, like a 1/6 of it, should be whole grain carbohydrates, not the refined sugars, not the refined carbohydrates, because this is going to finish you. So, and you should not just eat because you are hungry, but because you should not eat just because it's time to eat, but you should eat because you really need the food. Eat when you are hungry. We have formed this habit, like you have to eat by the clock. It is not supposed to be like that, because if you eat like that by the clock, then you are harming yourself. You are finding yourself giving yourself more calories even when you do not need the calories. And that is what we really need to change. Then the other powerful strategy is movement. And this is a very powerful non-prescription drug. Just walking for 30 minutes will lower your blood pressure, will reduce your insulin resistance, and release the happiness hormones, which you. So you are not just walking for health, but you are walking away from these life-threatening conditions. Because by walking, you increase your feel-good hormones, you help your body to respond better to insulin, and then you also increase and improve your chances of sleeping well, especially exposing yourself to adequate sunlight in the morning, even for just 10 minutes as you walk around. This could mean you getting a good night's sleep. If you really want to know some of the tips that would include in your life to help sleep better, you can look at some other videos in my overall health YouTube channel. They will give you tips on how to sleep better and improve your health. So the other important strategy is stress management. Stress is always a hidden enemy, and you cannot look at your blood pressure. You are taking your medicine, you are walking, but if you are not managing your stress, then your blood pressure will not be able to be controlled. And I've seen many patients, if you don't spend your time, you will keep refilling their drug supply. But the elephant in the house is the stress that they are suffering from. Someone could be having work-related issues, family-related issues, has poor connections with the friends, and there are many things that are bothering the person, such that he does not even have adequate sleep. This will affect his compliance to the medicine, will also make him or her release high amounts of cortisol. And the cortisol is a stress hormone. And then you release the hormones for the fight and flight mood. So you're always on a fight or a flight mood. So your adrenaline is some of these techniques. One, having a daily prayer program, and especially doing meditations. You can start with the 5 minutes in the morning, 5 minutes in the evening. Then you can possibly increase gradually until you can get to 30 minutes in the morning and 30 minutes in the evening. This will help you relax your mind and also call the inner energy that you have so that you can be able to cope up. And this also helps with relaxation. And as you continue doing this, you'll be able to deal better with the inner turmoil that you have and be able to cope better with the stresses that bother you on a daily basis. Then there is the practice of daily breathing, the 4x4x4 techniques, where you breathe in deeply for 4 seconds, and you breathe slowly, take your breath, and then you hold for 4 seconds. Then you again breathe out slowly for another 4 seconds, and you repeat this cycle for about 5 cycles. This will help you release tension within you. And even when you have a fight or a flight situation, unless it's something that if you put your voice low, you will find that many times you avoid unnecessary quarrels. And these are simple techniques that you can learn in life, and they can help you and make a lot of difference in your life. Rather than creating high tension situation, you are able to be controlled and be in charge of your life. Then the other power technique is sleep. Sometimes this is the missing link. I've seen many of my patients, they have hypertension or they have diabetes, they're exercising, they're eating very well, but now the challenge comes when it comes to sleep. You find that someone possibly would want to get to bed, and then she finds herself or himself by 3, she has lost sleep, or even when he gets to bed, he cannot sleep. There are techniques that you can use to improve your sleep If you want more tips on how to sleep better, what lifestyle changes to make in your bedroom and in your routines to make you sleep better, please check the video on sleep in the overall health YouTube channel. You'll get the tips on how to make your sleep get better. So sleep deprivation will make your blood sugar go high, and it will also make your blood sugar go high. So that when you improve your sleep, you also see a miracle in the control of your blood pressure, and this will make a lot of difference on the control of your blood sugar and also the control of your blood pressure. And if you can be able to manage these strategies and incorporate them in your life, then you realize that you will be able to manage your weight, you will be able to manage your blood pressure, you will manage stressful situations in your life, and this will help you to be able to get the full benefits of the drug that you are using for the blood pressure control. So these are not just hacks, but they are really scientific proven strategies that will help you control your blood pressure and control your blood sugar. So this far you have come. Thank you very much for staying with me. We still have more hacks and more ways that we can use to control our blood pressure and our blood sugar using lifestyle changes. So stay tuned, and also remember to send your comments on the comment section of this video, and if you have any question, please put them up on the comments section. I'll answer them at the end of this live presentation. Also, I encourage you, if you have diabetes or you have hypertension, among the strategies that I'm talking about, which one have you been using? How have they worked for you? Or which ones have you learned that you really feel you vibe with and you want to incorporate it in your lifestyle? So let me know that this is what you have liked, this is what you are going to incorporate in your lifestyle, so that you are able to control your blood sugar and also control your blood pressure. Then the last strategy is habits that support the others. Knowing that the most critical things in a person's life is the social connections that we have. In one of my blogs, I've talked about the power of social connections. You can find the blog article in the Wellness Health Services website, the blog section, and you realize that people who have stable connection, stable relationship, where they're able to have time with their family members, either by their spouse or close friends, they are in a better position to have their blood pressure well controlled, to have their blood sugar well controlled, and they sleep better. So, and the unfortunate part of it is also you have unstable relationship. They also make your life difficult, and they make it difficult to control your blood sugar, and they make it difficult for you to control your blood pressure. So you need to invest in your social connections so that you are able to control your blood sugar, you are able to control your hypertension. And it has been shown that people who have supportive relationship, they have less heart attacks, they have well-controlled weight, they are able to persist in the exercise program, and even they are able to persist in the initiative that they undertake. So if you are in a marital relationship, then it is necessary that you also spend time making your relationship work. You avoid things that, or you work on how to communicate better, how to spend time with your spouse. These look like far-fetched arguments, but the truth is they have been proved scientifically that if you're in stable relationship, you are in a better situation to control your blood sugar, to control your blood pressure, and also stick to your routines and build habits that are life-saving. So think about that and consider that in your life. So it is important that you surround yourself with the people who will work the journey with you, and this will help you be able to internalize all these strategies that we have talked about, and then you are able to live a better life and to be able to control your blood sugar and your blood pressure in a better way. So what happens when you don't change? What happens when you don't apply these life-changing relationship strategies in your life? Jane is a 35-year-old lady. She had blood pressure. She occasionally came for her clinics, but one day she collapsed, and her blood pressure was 244, and her lower pressure was at 120. She had suffered a stroke only at the age of 35. After that, she had one side that was paralyzed. It was a hemorrhagic stroke, so she had accumulated blood in her brain, and so luckily she survived it. She underwent rehabilitation. She's progressively getting better, but you do not have to get yourself there. Sometimes we think we have time, sometimes we think it is not a serious thing. And the most important thing is looking at your life. And I always say that when you present yourself to the doctor, possibly some of these lifestyle diseases, they are just giving you a report card. This is how you have lived your life. You need to change direction. And this is your wake-up call. And the good thing is your body does not just strike. It gives you warnings. But you also don't want to wait for the warnings. Be proactive. How can you be proactive? One is be checking your weight. How is it? Know how to calculate your body mass index. If you look at some of my previous videos, I have talked about how to do the body mass index, and you can calculate it. It is your weight and your height. Your weight in kilograms divided by your height in meters squared, and you get your BMI. The value you get, you can look at, there are some charts that I have put on my social media channels, and you can see how to interpret that. Then measure your abdominal circumference at the level of the belly button. If you're a man, it should not go beyond 102 centimeters. If you're a woman, it should be less than 88 centimeters. Then keep checking your blood sugar, especially if you are above the age of 40. And or if you are 35, there is a family history of type 2 diabetes in your family, then you need to be doing your blood sugar on every 3 months. Then look at your lifestyle. Are you exercising? Incorporate exercises in your life so that this will help you live a healthy life. Look at your diet. Are you eating a lot of sugar? And sugar has been found to be one of the most dangerous things that is harming people's health. So why do you need all that sugar that you are taking? You need to start cutting down on your sugar. And you also need to make sure that you are sleeping adequately. Then build your social connections. So do not wait to be given a warning by a stroke or a heart attack, or your heart has failed, or your kidneys have failed, because these things will not make it easy for you. So when you have learned these techniques, the goodness is that even people who have gotten diabetes, even people who are obese, even people who are overweight, they can comfortably reverse their diabetes. They can comfortably reduce their weight. They can control their hypertension with drugs and these lifestyle changes. And I have seen many patients take charge of their life. Those who are very determined, they have been able to reverse diabetes, reverse pre-diabetes situations. And on Monday, we'll be talking about reversing pre-diabetes. If you're already at the pre-diabetic station, by life up slowly and then make it a habit. And if you really want to know how to build habits, I've talked about this in one of my newsletter articles, how to make life-changing habits through sequential building of habits. You have to create a cue, you have to make it a routine, and then you have to have a reward. Then this habit can be sustained. And if you can do an activity for about a month to 90 days, 60 to 90 days, then by the time you reach 60 to 90 days, this habit has become a routine, it has become a habit, and you will not find it difficult. In fact, you will not even think twice about what you are supposed to do. If it is jogging, you just find yourself that if you don't, you know, it will come automatically that at this time is my jogging time. At this time, this is the kind of food I am supposed to eat. So this inclination to eat the sugars, the refined food, you just find yourself having an easy time to maintain that. Of course, that does not come out automatically. It comes out slowly with eating now, not a lot, but eating whole grains, removed all the sugars in his diet, has removed all the refined carbohydrates, the white flours, the white wheat, the white rice, all those he has removed. And now he has been able to control. Initially, he was using 3 drugs to control his diabetes. Now he's only on 1 drug. And this is very encouraging. He has also reduced his hypertension medicines from 4. He's now using only 2. So you can see these lifestyle changes can help you get an undeniable result. This is something that you can even see for yourself. So in 3 months, his BP was well controlled and he's able to continue with his lifestyle. And I'm very sure if he continues like this, he'll get out of the diabetes drugs, he'll get out of the hypertension drug. And what a better way. Because controlling your hypertension or your diabetes with the drugs is very important. But remember, if you do not change your lifestyle, what we are doing is delaying the time that you get with the complication. But if you can fix your lifestyle, then you also fix the chances of getting complications. And what is it that you want in life? You want to live your own life, enjoy it without having to take your drug, and live to be old without any complications, without any fear that you have complications of some of these conditions. So now it is your turn, you my viewer who have been watching this live. Which change will you start today? We have talked about your diet. We have talked about exercises. We have talked about sleep. We have talked about building social connections. And so look, what would you want to take to begin with? Then you can stick it to another habit and you build a habit continuum of healthy lifestyle. So remember, this is what will sort your problems, and this is what is going to help you live a better life, be able to control your diabetes, and also be able to regain your health. So pick one habit, make a comment on which habit you want to pick, and also I'll also answer your question now. If you have any question, if you have been having any challenge in those areas, are you having challenges in your diet? Which kind of challenge are you having with your diet? Are you having problems with the exercise? What are some of the challenges you're having in exercise? Are you having challenges in your social connections? Are you having challenges in your sleep? So let's look at some of the problems that you have been having, and we see how we can be able to work together to solve some of these. And that way, we'll be able to crack some of the things that have been giving you challenges in your life. So tell me, are you on medication? Have you had any challenges? This is the time to talk about it. This is the time that we need to answer your questions. So have you been having any challenges? So let's look at What challenges have you been having? So send your questions so that we see the challenges that you have been having, what you have been doing, and we can be able to look at some of the challenges. So I encourage you, my viewers, ask questions. Is training your body to take one meal a day good for my health? Also talk about typophobia. I do not know if I got the spelling well. I'm not really sure. I am also getting the typophobia thing. Possibly it could be a pronunciation thing. But thank you very much. This person has asked about taking one meal a day. There is room for what we call intermittent fasting. Intermittent fasting is where you decide you eat within a given period of time. And this is very, very much encouraged, especially for people who have weight problems. How does intermittent fasting work? If you really want to get the details, go to my YouTube channel, The Overall Health. There's a video on how to do intermittent fasting. I've also done a blog article on how it works. But the most important thing is, if you have excess weight, either you are overweight or you are obese, you need, when you eat, your body is stimulated to either use the food that you have eaten for energy, or if the food is excess, to store it as fat. So how does intermittent fasting work? Anytime you eat, the body secretes insulin to convert excess glucose to either glycogen or to fat. And this happens every time you eat. So if you eat now, your body for the next 2 or 3 hours will be working to try to convert that food into glycogen or fat. And the more you eat, the more you put your body into this response. Remember that insulin is an inflammatory hormone. So the more you stimulate your body to secrete insulin, the more you get it secreted, the more you are activating inflammatory processes in your body. So the best thing is you have to increase the one that there is the people who have 1 meal in a day. If you can be able to do that, you need training to do that, and you need also to work with your doctor. There are those who have 2 meals. If you have decided to eat 2 meals in a day, then you should have at least 16 hours of fasting, and you eat within a duration of 8 hours. So within these 8 hours, you can have your 2 meals. So that for 16 hours, your body is not secreting any much insulin, but it is converting the fat that it has restored and consuming it. And it does not only consume fat, it also consumes any other abnormal cells that are in the body, thus reducing your chances of getting cancer cells accumulating in your body, inflammatory toxins accumulating in your body. It's like a detoxification process for your body. And you find that you are breaking fats more than you are building fats. And that is the beauty of intermittent fasting. So this would be a good way of helping you to lose weight and also fight immune responses that could be harming your body in a very natural way. So intermittent fasting is good. Consult with your health provider so that you get what is applicable with you, and then you can see if you have diabetes or hypertension, you can see how to adjust your drugs so that you also don't get in situations that your sugar goes too low. And I found that patients who practice intermittent fasting, they are able to lose weight in a very well controlled way. So that is the way I would answer that question on intermittent fasting. So Frida, is past emotional stress when I was growing up affect my gain weight now? It seems gaining weight fast. I grew up in a mistreated environment by my parents. Sorry for this, Frida. I know that stress, as I've said, is one of the triggers for hypertension, is one of the triggers for diabetes. It is one of the triggers for gaining weight, and it is one of the triggers for having poor sleep. Now, past emotional stress, how do you deal with it? I'm not a psychologist, but I'll deal with it from a medical point of view. The first thing is you need to come to terms with what happened to you as a child. At the end of it all, you need to see what happened into your life. If your parents are there, if you are able to be taken through counseling so that you release most of this tension that you have and be able to forgive them. And once you are able to forgive them, you will not blame everything that happens on you, on them, but you'll be able to take responsibility on your life. And then you become more in charge of your life than them controlling your life. Because the bitterness that you still have about your parents, the bitterness that you have about your childhood is still affecting you. So, I see the pain that you have, Frida, and I know this can be very hurting. My advice is get a counselor. There is nothing that is impossible. And I usually say that when you find a problem that you are not able to solve, it is only that you do not have the skills at this particular time to sort that problem. But if you get the right counselor, he will take you through the healing process. You will be able, even if you are not able to forgive for now, you will be able to come to terms what happened to you, how is it affecting your body, and also you can be able to come up with strategies that can help you cope better. Possibly, if you it's okay with you, you can directly message me on my WhatsApp. We can talk more about this. I can connect you to my counselors and they can be able to take you through this process, either virtually or physically, depending on where you are in this part of this country. I really feel for you, Frida, but I can assure you that there is a solution. You do not need, I know you feel abandoned, you feel let down, especially when it is coming from your parents, but there is always a possibility that you can heal. As I said, you may not have the techniques now, but with the time, with the assistance of someone, you can be able to heal and you can be able to restart your life again. So know that there is help. So my number is 0723 459929. You can directly message me or you can just book yourself an appointment in the overall health website and we can talk more. I get you, Frida, and I feel your pain. Sorry for what has happened to you. So any other question? Anything that you really feel I need to address in this live presentation? This is why I'm here. I really want us to take charge of our lives. I really want us to be able to control our blood pressure, control our sugar, and more than that, take charge of our lives before it overcomes you. There's a question that has been asked: can continued stay without sex cause prostate problems? The answer is no. The answer is no. There are many relationships between sex and prostate cancer, but there is no direct correlation between sex and prostate cancer, such that if you do not have sex, you get prostate cancer. It doesn't work like that. But if you're able to have it, well and good, but it is not one of the known risk factors for having prostate cancer. Some of the known risk for prostate cancer include things like smoking, alcohol intake, a family history of prostate cancer. These are some of the things that would put you at risk of getting prostate cancer. And of course, obesity, having overweight, these are some of the risks that could put you at risk of getting prostate cancer. So thank you very much. I'm looking for more comments, more questions. I want us to look at the question that you have in this live presentation. We are talking about how to take charge of your hypertension and the diabetes the natural way using lifestyle changes. So if you have any question, if there is anything that you have gotten from this live presentation, put your comments. Otherwise, I'm very thankful. Thank you for those who have joined the live. Thanks for those who have asked questions. And thank you for those who have continued supporting me in our journey to help build a better society. We are going to one video at a time, one live presentation, so that we live better. Remember that health is in your house. Health is in your lifestyle. It is not in the doctor's clinic. It is what you do on an everyday basis that determines what conditions you get. Your visit to the doctor is just going there to get your report card of what is happening to you. Before that, be proactive, take charge of your life. Remember to subscribe to the Overall Health YouTube channel to get informed of when new content is released, and also make your comments on the comment section of the videos so that we know what we can do better and what some of the assistance these videos are giving you, and also if there are any harms or any problem that you have had with my videos, you can also make your comments on the comment section. Thank you very much. Remember to subscribe. I see you on the live on Monday. We will be talking about reversing diabetes the natural way. Thank you very much.
What's that?